I'm Dr. Lutgardo Caparas Jr. Most of the time, my close friend, they call me Jun Cap. And then I'm known in the field as Doc Jun Caparas. I'm a plastic surgeon by specialty, which means a plastic surgeon can do both reconstruction and aesthetic. Most of my patients are into the aesthetic thing. And I'm a diplomate of the Philippine Association of Plastic, Reconstructive, and Aesthetic Surgeon, in short, Paparas, and a fellow of the Philippine College of Surgeons. Why is this important? Because it means that the doctor who are members of this organization are credible, and we know what we're saying and we know what we're doing. I started way back in 1997. The reason why I want to go into this field that time was, number one, I'm fascinated by the two specialties of plastic surgery, reconstruction and aesthetic, which means I can do both reconstruction and aesthetic. So I can help patients with deformities like cleft lips, burn patients, and at the same time, I can do aesthetic surgeries on most of my patients, which is probably about 90% of my practice is basically aesthetic. Having my own clinic is a dream. The reason for this is I can do things that I want to do if it's your own. And with this center, I can do marketings, I can do any new developments that I can push for this clinic. So that's the advantage of having your own clinic. In this center, I do almost everything of aesthetic plastic surgeries and some reconstructive surgeries. But then I'm noted to do a lot of breast augmentation, breast aesthetic surgeries, blepharoplasties, and body contouring procedures like tummy tuck, liposuction. And as I've said, I do from the tip of the hair to the toe, and also do rhinoplasties in the center. I have 2 operating rooms, fully equipped to do general surgeries under general anesthesia. It's fully equipped. That's the reason why we ask for Department of Health accreditation, because you cannot put up a clinic like this without accreditation given by the Department of Health. So this is a center that's Department of Health accredited. I have 3 operating room nurses and then 1 RA, and I have office manager, receptionist. And yes, this clinic is open to plastic surgeon, people who have the right credentials, which means that they should be diplomate in this field of plastic surgery. They have to go through the process. Number one, I really need to see them for actual consult, because in there I can discuss every facet of how the procedure is done, from knowing why they want to do it. I discuss also the advantage of getting the right implants and what do they really want. So initial consult is a must for me, and with that, probably I can give them more good results if we do the initial consult, I would say, comprehensively. Oh, greatly affected my practice, because most of my patients are coming from abroad and they cannot travel to have the surgeries done. But then we're blessed. Probably God really blessed us because we haven't stopped doing surgeries in this center. We go through the different health protocols. It's being done in all clinics. And what I emphasize here is I don't do surgeries. Patients that don't want to undergo swab testing, especially if they're going to do major surgeries under general anesthesia, under spinal anesthesia, they have to go through the process of RT-PCR. And I also use RT-PCR when I'm doing any surgery in the nasopharyngeal area. Some others, the basic laboratory that we ask in terms of COVID diagnosis is the antigen test. And all patients would be undergoing the different laboratory exams before they can undergo the major surgeries that I usually perform. we can give you the clinic number and address so they can contact the office manager, the receptionist, and they can make a schedule for consults with me. As I've said, face-to-face consultation is a must as long as they have undergone the basic health protocols. Like we have a QR code that they need to fill up, and before they can come in, they have to have those data that should be forwarded to the clinic. So that's how we go through this process of seeing a patient, because it's very, very difficult to operate on a patient just by virtual. Probably virtual consultation is acceptable, but then before a patient can be scheduled for surgery, I need to see them, because it would be best if I can see them personally so that I can properly evaluate their needs.